This is a cross-section of the heart. The cross-section passes through the ventricles, and it shows you how the thickness of the two ventricles differ from each other. So obviously, this is the right ventricle, which is not as much as thick of the left ventricle. And you can see here, this is the interventricular septum. It's when you open the anterior wall, you will face the interventricular septum that bulges into the right ventricle. That's why the cavity of the right ventricle, as you can see it here, is like a crescent, a croissant, while there's a circular profile here in a section of the left ventricle that looks like a donut. And you can see that the interventricular septum has the thickness of the left ventricle. It is part of the left ventricle, and that the wall of the left ventricle is as 3 times as thick as the wall of the right ventricle, because it has to pump the blood against 120 millimeter of blood pressure in the systemic circulation. And you can see the inside of both ventricles has multiple of these trabeculae carni, thickenings of cardiac muscle fibers in the wall. And you can see here some of the papillary muscles with chordae tendineae in this section.